Hi everyone, my name is Dr. Tracey McConnell and I am working on this project with a team of researchers from the School of Nursing and Midwifery at Queen's University Belfast and also from Nuffield Department of Primary Care Health Services at the University of Oxford. And we also have patients involved in this research with us. So we are all passionate about improving the quality of life of people living with heart failure and their loved ones. So for those of you who may not be sure what way heart failure affects patients, it is an illness that mostly impacts on those of an older age, those 65 years and older. And what happens is the heart is not able to pump blood adequately around the body to help meet the body's needs. So people with advanced stages of heart failure can experience frequent and distressing symptoms, which really negatively impacts their quality of life. And that can be despite the best medical therapies available. So these patients would benefit from having palliative care integrated into their everyday heart failure management. Now, palliative care has traditionally been associated with the care of patients with advanced cancer, but its benefits are increasingly being recognised and used in other chronic or long-term life-limiting illnesses such as heart failure. So palliative care can do much to alleviate suffering for those with heart failure. It focuses on adding treatment options that help address the physical symptoms, psychosocial and the spiritual needs of patients. So really improving quality of life overall for both the patient and their loved ones. The problem is that integration of palliative care into the management of heart failure remains infrequent and problematic. So for example, only 7% of people with advanced heart failure are placed on the primary care palliative register in the UK, and that's compared to 48% of those with advanced cancer. And although we have evidence for improved outcomes when palliative care is delivered along with active heart failure management, the available research has reported very different types of care. So care delivered in different settings, whether that be inpatient, outpatient, delivered by different healthcare professionals, so that could be cardiologists, heart failure nurses or the patient's GP, using different methods of delivery, so it could be face-to-face or via telemedicine, and also involving different components of palliative care. So some will focus on symptom management only, or some may focus on advanced care planning. So in summary, we know that integrating palliative care for patients with advanced stages of heart failure can benefit both them and their carers and loved ones. But it does remain unclear what brings about the best outcomes for patients and their loved ones. So this is why this research is so important and what we are trying to address. So please do check out the rest of the website or get in touch with us directly if you would like to find out more. So thank you so much for listening and take care.